What is the history of caregiving roles? Imagine a time when caring for the sick was a community effort, rooted in tradition and family bonds. That's how caregiving began thousands of years ago. In ancient Egypt, Greece, and Rome, families or local healers provided basic medical help and comfort. Caregiving was often tied to cultural and religious beliefs, with some societies relying on slaves or servants for tasks like child care. Women from poorer households usually took on these roles, often sacrificing their own time and resources to care for loved ones. Fast forward to the 19th century, and caregiving started to change dramatically. Florence Nightingale's work during the Crimean War in the 1850s was a turning point. She emphasized cleanliness, hygiene, and scientific approaches to patient care. Her efforts led to the creation of the first professional nursing school in 1860, which set new standards for caregiving. Hospitals and asylums also grew in number, employing trained nurses and caregivers to look after the sick and mentally ill. This shift marked the beginning of caregiving as a respected, organized profession. In the 20th century, caregiving roles expanded even further. Nursing became a formal career with education and professional organizations supporting caregivers. At the same time, the focus moved from hospitals to home and community care. As populations aged and neurological conditions like brain cancer, strokes, and dementia became more common, the need for home-based support grew. Organized agencies began offering skilled nursing, personal care, and emotional support directly in patients' homes, making care more accessible and personalized. Despite these advances, family and friends have remained the core of caregiving, especially for those with chronic neurological conditions affecting brain health. For many years, unpaid caregivers, mostly women, provided essential hands-on care. They helped with bathing, wound care, medication management, and emotional support without formal training. Over time, organizations like the Family Caregiver Alliance have worked to raise awareness and provide resources, education, and respite for these dedicated individuals. Today, we see a more integrated approach to caregiving. Laws like the Americans with Disabilities Act and the Older Americans Act promote community support and access to services. Technology also plays a role, with telehealth enabling caregivers to monitor and assist patients remotely. Caregiver resource centers and national programs now offer training, emotional support, and advocacy, recognizing the vital role caregivers play in managing complex health issues like brain cancer. When it comes to brain cancer and neurological conditions, caregiving requires specialized knowledge. Caregivers need to understand symptoms, treatment side effects, and changes in cognition. The evolution from informal family care to a mix of professional and family support reflects the complexity of these conditions. Effective caregiving today involves working closely with healthcare teams, managing complex medication regimens, and addressing emotional and cognitive challenges. This history shows how caregiving has grown from simple support to a sophisticated system that combines medical expertise with heartfelt compassion. It highlights the importance of ongoing education, resources, and support for caregivers, who are essential in helping individuals live better with brain health challenges. Always remember to consult healthcare professionals for personalized advice, as each person's experience with neurological conditions is unique.